Those who are immunocompromised are at a higher risk of negative effects due to COVID-19 if they are exposed. But those people cannot stay inside forever. For one, it's important that they follow up regularly with their doctor. News 5's Cherish Lombard is joining us from her home to tell us how the staff at USA Health Mitchell Center is making that a little bit easier. Cherish?
Yeah, unfortunately, not everyone is seeing their doctor when they should. Patients are canceling appointments due to fears of contracting coronavirus while they're at their doctor's office. And it's not just patients who are immunocompromised. Some doctors say their biggest fear is patients missing appointments for regular screenings. The coronavirus is front and center when it comes to our health. But medical experts are afraid that people skipping regular doctor visits due to coronavirus fears will lead to a much bigger problem in the future.
The thing that keeps me up at night is the fear that 6 to 12 months down the road, we're going to run into a situation where we see a whole lot of new cancers that were diagnosed either late in the game or we just missed it altogether.
Dr. Jennifer Scalisi, an oncologist with the Mitchell Cancer Institute, says that's why it's so important for you to keep your healthcare maintenance appointments for mammograms, colonoscopies, and annual OB/GYN screenings. Because the coronavirus is evolving, the team at USA Health is doing a number of things to try to minimize patients' risk of exposure. Virtual visits are now being used whenever possible. For those who need to see a doctor in person, screenings are being done before anyone can walk through the doors. Everyone has to wear a mask, and appointments are even being combined in some cases.
It's been super helpful to have those patients see their primary care physician via video, while sometimes they're even in our office, so we can help modulate and moderate some of their other medical problems at the same time that we're able to treat their cancer.
Dr. Scalisi says she believes virtual visits will revolutionize what's being done as far as patient care at MCI, and she thinks this will continue.
Walking in the building, terrified of what's going on outside, terrified with a cancer diagnosis. We want to do as much as we can to reassure that we are here, we are open, we are going to keep you as safe as we can, and we still want to move forward and treat the disease that we were treating, which is their cancer.
I'm told doctors are also testing new chemotherapy and radiation patients for COVID-19, so they aren't treating anyone with a known positive diagnosis with something that could further weaken their immune system. Cherish Lombard, WKRG News 5.